We are taking your calls today for Dr. Jeff Pothof.
The number to call is 608-270-9933. We have 3 lines open if you have a question for Dr. Pothof.
Good to see you.
Yeah, good to see you.
Welcome back. Hello, doctor.
Hey, sorry, I'm not paying attention here.
So the flu, we sort of dodged a bullet there. The vaccine seems to have hit the mark pretty well.
Yeah, so if we look at flu data this year, the flu vaccine, if you look at adults, it reduced their likelihood of hospitalization by 50%. That's really good for a flu shot. Even better for children, reduced their likelihood of hospitalization by 75%. So in all the mess of, COVID and everything going on right now, the flu shot was a clear winner this year.
Oh, that's good news. All right, should we get to the phones?
Sure, let's start with Bev in Beaver Dam. Hi, Bev, what's your question?
Hi, I've gotten all the vaccinations plus the booster for COVID. The last booster shot I got was in September of last year. I'm assuming that is good for about 6 months. What do I do pretty soon?
Does she need another one?
Yeah, no, this is a great question because a lot of folks are wondering, I've got this booster. If you got the bivalent booster, a lot of folks got it back last fall, and there hasn't been a lot of information out there on what to do next. So what we know right now is that there isn't a recommendation to get another booster at the moment. We think that the CDC will likely go to about a once annual vaccine. And the reason they can do that is even though after getting the booster, you have really good protection against any symptoms for a couple months, and then you can get symptoms again. The real thing they're looking at, though, is that protection against severe disease. And what we're finding is that even with that booster last September, protection against severe disease is likely to last at least 10 months, maybe up to 12 months. So that's where they've been going with it, is really getting boosted patients that long-term protection against severe disease and not so much worrying about whether someone comes down with more mild symptoms.
Okay. And if you had COVID, you're good for about 10 months or so now.
Yeah, there's this new study that was published. It was in the Lancet, and it really looked at not so much the Omicron variant, so it might not hold up with that, but for those variants before Omicron, if you got a natural infection, you would then have protection for about 10 months against severe disease, just like the boosters.
All right, let's go to Carol in Middleton. Hi, Carol, what's your question?
I have a question concerning vaccinations also. I received a booster in September of 2022, and I'm wondering if I need to have another one.
Yeah, similar to the last caller, a lot of people are wondering about this. So I think it's really good to let folks know that if you've gotten that bivalent booster, that last booster that was initially available in fall of last year, you're good right now. What that means for you is that if you came in contact with COVID, you might develop symptoms, but those symptoms would likely be mild to maybe moderate. Your protection against severe disease, which we really care about, keeping you out of the hospital, certainly keeping you from dying, that protection's still really good, will probably still be good until August, September of next year.
But if you still get COVID now, you test positive, you still have to quarantine and do the regular protocol, right? Quarantine for 5 days and...
Yeah, just so that we're not spreading around to other folks, kind of keep it to ourselves. But a lot of people nowadays are doing pretty well with their COVID-19.
Yeah,
why don't they recommend that for flu?
That's a good question. I think likely some of the reason for not recommending it with flu would be that the rate of people getting super sick, dying from influenza is so much lower. But it might be something coming out of the pandemic that we end up thinking about. In general, we do recommend that if you're sick, you stay home. I just think we didn't do it that well until COVID came around.
No, you're probably right. We've learned a lot. Yeah, that's very true.
All right, do we have time for one more? All right, let's go to Maureen in Wanakee. Hi, what's your question? Maureen, you there?
Yes, I'm here.
Go ahead, what's your question?
My question is related to the study that came out today in the paper from Germany about how COVID elevates the risk of autoimmune disease. And I'm wondering how we should be monitoring people who have COVID more than once as to whether what their signs are really COVID or the development of an autoimmune disease.
Yeah, I think that's a good question too. And I haven't seen the study from today, but there are other studies that look at COVID-19. And the way that COVID-19 makes you really sick is not so much the virus itself, but the virus really gets your immune system active. And that's where people go into respiratory stress and things like that. Now, what they see is that folks who have recovered from COVID, their immune systems are still kind of overactive. And that is kind of the scenario we might see other autoimmune diseases such as, lupus or Sjogren's or things like that. I don't think we know enough to say that there's going to be this direct link, but certainly something that researchers will be paying attention to in the future as we look at long-term effects of COVID infection.
And we don't really know the long haul, what the long haul is on this.
No, we still have people from years ago that are still having some symptoms. So we'll learn a lot over the next decade or so, but not definitive knowledge on what goes on with long COVID yet.
It's not going to go away.
No, for sure not.
We're living with it, though, right?
We are.
All right. Thank you all for calling in. We are out of time. We'll do this again
Yeah, we'll do it very soon.
next week.